Thank you for joining us tonight, Professors. If I could start with you, Tony Blakely. The government started publishing daily data on the vaccination rollout, but does that data actually give us a really clear picture of the situation on the ground?
Well, the data I've seen so far, not quite, because it's still not split up by GPs and whether it's state or federal, which makes it quite hard to track. There's obviously something not working well behind the scenes with the age sex register where the information's being entered and being able to get it back. But at least they're moving that way because we need more transparency for the public to be part of this in the control room, in the same way that we did when the case numbers went up and we got better reporting, everybody could buy into what's happening. So steps in the right direction.
And Professor McLaws, how important is that data and that transparency for rebuilding confidence? I mean, it seems to have taken a really big hit. And what sort of data do we really need to see?
Laura, what we really need to see is which vaccine is being rolled out and to whom, and whether it's Pfizer, AstraZeneca, what age group would be very helpful. We need this because the over 50 are getting a little vaccine hesitant because they think they're getting a second-rate one. They're not. The under 50s are getting the vaccine that they need. Personally, from an epidemiological perspective, we need people who are 20 to 39 for epidemiological reasons to be prevented from acquiring it because they're the biggest group. There were about 41 to 50% of cases in the second wave. If we can protect them with a vaccine that only takes 21 days between two doses, then the most vulnerable will be protected.
Tony Blakely, do we know, apart from supply questions, whether the state infrastructure for distributing vaccines is working better than the federal infrastructure?
Look, it's really hard to tell, and I've found it hard to work out. But what we do know is that the supply has been a major issue, so we've been unlucky. But there's certainly problems happening in delivery. It's almost like they haven't got that track and trace you've got for the curious. You don't know where the vaccines are at what particular time. We need to find out more about this. I'm also reminded of what happened in the UK way back at the start of the pandemic where they subcontracted out to private industry, the contact tracing, and it really didn't work. And now their vaccine rollout is all through the NHS. National Health Service, which is a bit more command and control. We've got real challenges here because of the classic state-federal tension, also GPs being off one angle, pharmacies over here. We need to really up our game here. It's not easy, but we need to get that logistics and distribution much better.
Mary-Louise McLaws, other countries have gone for mass vaccination programs up front. We didn't. Was that the wrong strategy?
I've been calling for mass vaccination for a while now. At the beginning of the year, I estimated that if we didn't get at least 160,000 injections per day, we'd never make any of the targets. And at the moment, over the last 2 weeks, we've got about 24,000 injections per day. That's nowhere near enough, and the poor old GPs can't be expected to ramp that up. They've also got their regular patients as well. So we do need mass vaccination. However, you also need mass supply to be able to cope with that daily injection numbers. So I've estimated that we probably need about 40,000 injections per day for AstraZeneca to reach to the end of, say, maybe June next year, and then 60,000 injections per day of Pfizer at about the same rate if we get the Pfizer by September this year. And then we'll all finish together, the AstraZeneca and the Pfizer together. Otherwise, we won't be finished at least until the end of next year.
Thank you both for your time tonight.
Pleasure. Thank you.
Thank you, Laura.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.